Living a balanced lifestyle doesn't have to be a dream, and wellness doesn't have to be an activity you save for downtime. Instead, elevate your personal and professional life with the tips, tools, and insight to holistically support healthier habits. Join me, Dr. Callie Davis, in the Mind-Body Connection for enlightening conversations, inquisitive panel discussions, and illuminating stories from experts in the medical and healing communities who are leading the movement toward a holistic approach to health. Tonight, we have a very special guest on the podcast with Hands on Health. We are so excited to have Dr. Joe Mather. I've known Joe for quite a while, it seems now, pre-pandemic, let's say, professionally. And we have the pleasure of being work neighbors at Hands on Health in our little medical integrative healthcare suite. And
real life neighbors as well.
And real life neighbors, y'all. Real life neighbors for the past couple of years, which has been a real
block, so that counts, right?
Yes. And we've had also the real pleasure of meeting all of the Mather's kids. Such a joy when we understand why Dr. Mather has been sleep deprived a little bit over these past few years raising kids.
No one tells you that if you have 3 kids that you'll never sleep again.
So a busy father and professional researcher, mentor, podcaster. We have a lot to dive into tonight, and I wanted to be able to start us off with Dr. Joe's specialty, one of them, in functional medicine. So I am very intrigued, both professionally and personally, with all of these tidbits of knowledge that Dr. Joe Mather is always bringing to us in our community. And he tends to really look outside the box with cases. And so in an innovative and fresh perspective, he really tries to sort through, some of these problematic cases that have physicians and clinicians scratching their heads over what to do. So I guess we'll start there. Dr. Joe, how did you get into functional medicine and working through the layers of healthcare like you are right now?
Yeah, so I'm a family practice conventionally trained medical doctor, and at the tail end of my residency, I found myself in one of those boxes where everything that I was taught didn't help my patients with chronic disease. So it's great when you have conventional tools if you have a patient in the hospital, if you're doing surgery, if they have cancer, but for the vast majority of encounters in the healthcare system, they're chronic diseases. Mm-hmm. What do you do with someone with diarrhea, 4 times a week, who has abdominal pain, who's got blood sugar that's high? All the conventional tools just weren't helping. And so I looked outside the box, and outside the box of conventional medicine, I kind of fell in love with the idea of functional medicine. And the whole idea of functional medicine is that you can treat the root cause of a disease and get the patient to resolve that disease. The symptoms will go away if you look upstream or if you treat the reason for why they're sick. And it's such a basic, simple idea that's completely missed in that box of conventional medicine. So I have been doing some version of functional medicine really for the last 10 years. But at a certain point in my career, I found myself in another box because the functional medicine that I was taught, I quickly found had a lot in common with my conventional training in that it didn't work on patients. And so I had to kind of break out of the second box and figure, okay, let's start from the top. How do I get these patients better? Because as you practice medicine, and the months become years, and then the years become several years, the patients that come to you are sicker and sicker. And as you get more experience and get better at helping patients, you see more patients who tell you, you are my last hope. I've been to the Cleveland Clinic. I've been to Mayo. I've seen Dr. Hyman and 5 other specialists, and I don't know what to do. And so to help those patients, I really had to look way outside the box in some cases. And so what I do these days, I think of as a blend of the best parts of conventional and the best parts of functional medicine.
Nice. So I love it that you just walked us through like these two boxes. I also, yeah, I relate to this. I know a lot of our friends in healthcare that talk and walk this integrative pathway think this way too, common mindset of doing things differently because at the end of the day, you want to have achieved that feeling of having helped that patient, right? Like really having helped that individual patient. And we find, like you said, over the years, as you become more of the expert in the community, like, oh, that's really been a problem. People will refer to Dr. Joe Mather because the patient hasn't gotten well yet after seeking all kinds of different measures in conventional and alternative. And it really is like looking at that individual person that does not fit into any of the boxes, none of the cookie cutters, right?
That's the question that really has driven me is how do I help this patient? Because I'm one of those weirdos that I knew I wanted to be a doctor at like age 8. Right?
Yeah.
And I was lucky enough to be able to just make that happen. And you get out of university, go to medical school, all of a sudden you're a doctor. I just assumed that all I had to do was get through my training and I'd have the tools to just help people heal and it's off to the races.
Right.
I remember one day near the tail end of my residency, looking over my cases of that day. And this was late in my 3rd year, and I had already taken a job, knew I was going to work in New Zealand for a year. But I was looking at my charts, and no one had gotten better. I saw 10 patients that day, and no one was better. And yet, I knew that I was reading more than my classmates. I knew the guidelines better than them, right? And so I thought that, if I just kept reading more guidelines, reading more about new medications, I'd be able to help them. But I realized that the tools that we were taught really didn't have much to do with helping people heal. It wasn't too long before that day, I remembered I had a patient who did get better. And it was funny because I hadn't seen her in 3 or 6 months, and she walked in and she was a completely different person. Her eyes are sparkling. She's kind of bouncing. She had lost maybe 20 pounds. Her skin was clear. I was like, what the hell happened to you? It turns out she stopped doing everything I told her. So she stopped the high fiber diet. She stopped the ADA, American Diabetic Whole Foods diet, right? She started sleeping better, right? All of the guidelines. She stopped all the medications I was giving her, metformin and glyburide. She started healing because she was eating healthier. She was moving. She was sleeping. All the things I had never talked to her about.
Yeah.
And when I was kind of down on, man, how do I get my patients better? I remembered, and I said, geez, there has to be some place where I can go where they can teach me this lifestyle piece that I was missing. And that's when I found the Institute for Functional Medicine.
Nice. Yeah. And so really, did that take you through learning more about those pillars and fundamentals then, like sleep and movement and food?
It did to an extent. But my disappointment with the IFM is that it seemed to me that a lot of their training had to do with not prescribing medications, but bombing a patient with supplements. And so you get through a lecture on female health, and here's 12 nutrients you can give. You get through a lecture on chronic bloating. Here's 12 nutrients you can give on glucose, on weight loss, on brain fog. And it seems to me that some of the functional medicine educational bodies are paid for by labs and supplement companies. And so their educational materials tend to be a little biased. And so there is absolutely some wonderful things I learned there, but using that model, I came to realize was not going to be the answer.
I love that you're highlighting that because when I first began to discover and talk more with other practitioners about functional medicine doctors, it was, oh, this functional medicine doctor, but they use a lot of supplements was the next sentence. But they use a lot of supplements. And I'm like, and when I was first understanding what it was, who really wants to go and be like, oh, well, don't take these pharmaceutical pills, but do take these other pills?
It's like these practitioners have gotten to the point where they recognize that prescribing 12 medicines is a bad idea, but the leap they make is, okay, we're going to substitute lisinopril with potassium and magnesium, and all the way down the line, every drug just gets a natural replacement. But for the same reasons that patients do horrible on multiple medications, patients do horrible on multiple supplements.
Yes.
We get patients who have chronic GI problems, who have brain fog, who don't sleep, right, from supplements. And it's not uncommon that a patient will come to my clinic and the very first thing I'll ask them to do is stop every single supplement, because there's no way we can tell what's working or what's not working when there's just so many variables coming in, when they're taking so many things.
Right. And then it's like you're dealing with a more complex case just because they've been through the gamut of functional medicine treatments then.
Exactly. So you have, they've been sick and the conventional medical system hasn't helped them. So they go find another doctor who may be integrative trained, maybe functional medicine trained, maybe a holistic, maybe a naturalist, a dietitian. And each one of these stops, they pick up a couple supplements, and they don't get the full workup or the full story from any of those folks. So they end up substituting with Reddit forums and podcasts and blogs, and so then they end up self-treating. And so then by the time they see me, they're on this huge list of supplements, and they have no idea what's helping and what's not helping.
Yes. So I have a shortcut for all of you hands-on health listeners. Just go see Dr. Joe Mather, okay? Root cause. I would like to take that, because you're kind of leading us into an example there of that typical patient who's been through the two boxes of conventional medicine and functional medicine. And they arrive at your door and they're loaded with supplements. They've tried a lot of strategies. They're probably feeling pretty overwhelmed from all the strategies that they're implementing or have tried. And so how would you start with that patient in a visit to unpack like what the root issue is?
For most of these patients, they've been sick for 5 to 10 years, and they have a lot of insight into their symptoms and their illness. And so the first thing is just stopping and taking time to listen to their symptoms in their body right now.
Yes.
Not 3 years ago when they had that breath test that was maybe positive, or 5 years ago when the person told them that they had mold. What's happening right now? And with that basis, there's almost always things that were missed. And it comes down to kind of the biases of conventional and functional medicine. If they've mostly seen conventional doctors, the likelihood that they've missed a problem with sleep apnea, a sleep deficiency, poor circadian rhythm, dietary problem, maybe they're not eating enough, maybe they're eating too much, maybe they've messed up and they're eating way too much processed foods, maybe they think a carnivore diet's a good idea, right? You start with the lifestyle really heavily in the patients who've mostly done conventional, because that's most likely the piece that might have been missed. For the patients who've primarily seen integrative doctors, that's when it's really important to put your conventional hat on, right? I had a patient who came in to see me from Florida with a host of symptoms and problems, and this patient had been to a half dozen of the biggest names in functional medicine, so the people that are selling books and on podcasts and the famous people.
Which
and
seems to be in Florida, right?
The practitioners this person had met were not in Florida.
Okay.
Maybe, I don't know.
Thinking Clearwater, Jacksonville. Okay.
Not that one.
Okay.
But this person had an iron deficiency, a ferritin of 6. And all of the fanciest names ran a whole bunch of expensive tests, but no one corrected the iron deficiency.
Wow.
That if you just reviewed the chart, she had horrible periods, an early diagnosis of endometriosis, and clearly was iron deficient years before.
Right.
But all the functional medicine doctors, they wanted to treat their specialty, their MTHFR. They wanted to talk about the methylation. Another one wanted to do MCAS and just throw her on mast cell stabilization. So she was someone who the root cause was, let's just back up and make sure something simple as correcting an iron deficiency wasn't missed.
Right.
Okay.
Okay.
It helps helped her quickly.
Yeah, the real simple, like, I would think that that would go back to your like medical school training, right? Like one of those.
It's one of those layups that
Yeah.
shouldn't be missed.
Yes.
Right?
Yes.
Like you're off the team if you miss that layup.
Right. Wow. So,
So almost always what you look for the things that have been missed, overlooked, or maybe put to the side, and you find what gave or what gives symptom improvement. And if you're doing a good job, you should be able to identify a few things in their history that worked in the past year. You should also be able to, in the first month, give them 2-3 things to try, and whatever works to reduce symptom, that gives you the best insight into what system of the body needs more support. So if you
Right.
ask them to fast and the brain fog goes away, you have a very clear idea that this might be SIBO, right? If you put them on a lower carb diet, it might be insulin resistance, and on for whatever treatment you think that patient needs. And then you
Right.
double down on what works and you stop doing the things that aren't working.
okay. So now we know how to do your job.
That's right.
It's that simple, y'all.
I had a patient come in the other day and tell me, she's like, well, you know, there's so many more kids coming up with autism and Asperger's and on the spectrum, and we're going to need a lot of doctors like you to treat all them. I was like, God, that sounds like a lot of work. Like, we got to train other doctors.
Yeah.
It's too much for me to do.
Well, that actually, it's a little tangent here, but do you do any training of other physicians? I've never talked to you about that.
Yeah, I have, and I do.
Okay.
So at my last job, I was the medical director for the Russo Institute of Functional Medicine. And it was, you know, one of the best parts of my career was teaching those young doctors how to problem solve.
Yes.
What systems should they treat? What should they not treat? What works? What doesn't work?
Yeah.
What's snake oil? What's not? And currently, I mentor clients from Moss Nutrition. So Moss Nutrition is the supplement company that I have been using for a decade, and their practitioners will call me when they're stuck with cases. Right. So now I get to teach all of them.
Nice.
And I lecture at conferences occasionally and have a couple more things in the works.
Yeah, great. Because
Yeah.
that's, well, I heard that you're writing a book.
Yes. Books are hard to write. I'm approaching 90,000 words, and writing a book is like 10 times harder than you think it's going to be when you first start.
They don't write themselves.
No, they do not. Nope.
So, do you want to give us any peek into what the book is going to be about?
It's a lot of the things we've already talked about. It's talking about how functional medicine is, if it's not already there, it's quickly getting to the point where it's hurting more patients than it's helping.
Let's do bullet points on that, because I love this part of your brain where you would say functional medicine could end up harming this segment of the population. And how could it?
So I'm trying to be nice. I think it is hurting more people than it's helping. And the one way is financial harm. Okay, so many functional medicine doctors have made a business model where they make money by selling supplements directly to patients, and they sell labs directly to patients. This leads directly to the biggest problem in the field. Someone comes, they ask a functional medicine doctor for a workup. I had a patient who came in, he's from Virginia, flew into New Orleans and saw me. He had flown across the country, and the physician he saw in New York, before seeing him as a patient, had him do $6,000 worth of blood work.
Wow.
And that's not an uncommon story.
So that's just like through the protocol that they're receiving on the front end.
We need this blood work to treat you because everything has been missed. So instead of looking at what had already been done, instead of listening to the patient, and he just hears the blood work. And thankfully, I think a smoke alarm went off, and so the patient was unable to get the blood work, and so he was like saved by the bell, and then came to see me. Yeah, exactly. But so they order all these tests. So not just blood work, we get organic acid tests and cortisol tests and Dutch tests and mold toxin tests and heavy metal testing and everything under the sun. Stool tests, breath tests, and whatever the doctor's interest in, they may order a half dozen tests. And already a patient is several $1,000s in the hole, several $1,000s they don't have to spend on treatment.
Right.
So you have a lot of these tests are inaccurate. They're not black and white, right? The main thing patients want from a functional medicine doctor is to finally know the answer.
Yes.
And the promise is that if you just do that one more test, the one that every other doctor didn't think of, that you'll find that one answer and then
Right.
be able to give you the one pill
Right.
that will fix it, right? That's the hope. That's the underlying premise. The fact of the matter is that most of the labs just aren't accurate enough to deliver on that. They suggest possibilities, but they can't confirm. And then once you have the lab, it doesn't tell you how to treat the patient.
Right.
So a lot of waste happens that hurts patients, right? Once a doctor is kind of committed to that model, to keep the lights on, they have to keep doing it. Mm-hmm. And what happens is the patient comes in and they've done a half dozen tests and maybe 3 are positive. And then the doctor tries to treat them all at once. Mm-hmm. So nothing gets done. They don't know what's working, what's not working. And most of the functional medicine doctors then go their entire career without really knowing what worked and what didn't work.
Right.
Because they never did one thing at a time and reevaluated.
Because it was combination approach. Like, let's just throw all this at it. Or we call it shotgun approach sometimes.
Yeah, they just try to shotgun it. Mm-hmm. So it hurts patients because it wastes their money on tests that almost always aren't needed if you listen to the patient. They waste money on tests that are often not validated. Right? And then it creates an ineffective treatment program because the doctor feels like they have to treat the results. But if they have 3 test results, maybe 1 is the reason and 2 aren't, right?
Right.
So treatment is less effective.
Going in circles.
And then because they make money on testing, they feel like they have to retest whatever test was positive every few months.
Right.
Right? So the patient then is continuously the doctor and the patient are chasing lab values. And each time they do this, they get farther and farther away from, are these symptoms helping?
Yep.
Are your symptoms getting better with the treatment? So it's kind of a multiple layer that patients are hurt by. And so that's the high level of where it's hurting people.
Yeah, I could see how, given a year or two going down those rabbit holes, would be pretty negative impact for someone who is still sick, right? Like, at the end of the day, they're still
that's
feeling
the
like
thing.
crap.
They're putting all of their eggs on the functional medicine basket, and they're so desperate and ill that they're willing to spend the money and give the doctor the benefit of the doubt. And a lot of the doctors mean well.
Sure.
They are trying to help. Most of them really, really, really want nothing more than their patients to get better. But they
Sure.
bought into this system that leads them astray.
Right.
Right. And so that's what the book is about. And it's my suggestion of how they can move away from that kind of testing and over-treatment dominant model.
I love that. It really looks at the limitations of that system, where I feel like the perception of the savvy healthcare consumer is that, oh, functional medicine, that's the thing.
Yeah.
Right?
Yeah. So, and it's hard though, right, Kelly? Because it's not to say that conventional medicine is better, right?
Right.
So these poor patients, they've gone usually a dozen specialists, and most of them see a patient with symptoms that they don't really understand, and they say, go see another specialist, or here's a test and I don't know, or it's just stress. It's in your head, right? So patients get gaslit by the conventional system. The doctors think that they can fix chronic disease with a CBC, a CMP, a TSH, and a lipid panel, and they keep running those 4 tests over and over again, and they're like, well, your labs are normal, so
Right.
I guess it's maybe we'll get you a psych appointment. And not to say that mental health can't cause illness, but people know when they have mental health problems, and they know when they have physical problems, and it has to be the most horrifying, frustrating, devastating thing in the world to just be told by the conventional doctors, your tests are normal.
Yep.
Go somewhere else.
Yes.
So it's no surprise that these patients fall into integrative and conventional care, because conventional medicine offers them virtually nothing.
Okay, so in that approach where you're seeing the patient, and there's definitely a lot of stress involved, right? Because they've been seeking answers. They haven't really been getting, I'm interested in this word using.
They haven't made progress.
Yes, right. No progress, right? It's kicking the can down the road, per se. And so in that kind of situation where, we both like to talk about the nervous system and all of the facets, right? Sympathetic nervous system, fight or flight, trauma responses. So when you are assessing a patient who is also carrying some of that trauma, maybe it is medicalized trauma, maybe it is literally from the number of providers that they've been seeing that.
Yes, that happens a lot.
Yes. Yeah. Let's talk about that.
And so tell me the question. Is it more, how do I handle that with my patients, or is that a problem?
So I'd like you to give us the viewpoint that you have, like kind of let us look through your lens at the patient when they're carrying all of that extra, and they're thinking, maybe this is all in my head.
Yeah, because a lot of patients come in and they are thinking that because they've been told it or they've been questioning it. The first thing I do is I ask about trauma, I ask about depression, I ask about mood, and I usually don't treat that at the start of the case because my assumption is that the problems are physical, that something was missed before I just rule it off as a mental health problem. In large part because so many of my patients have been told that again and again incorrectly.
Right.
It's just depression, happens when you get older, blah, blah, blah.
Right.
And so many times a physical problem is there to be solved, and then they feel better. It's like, well, yeah, I guess it was just an iron deficiency. I guess you just had SIBO that was missed, or whatever it is. But I always, whenever I get a sense when I'm meeting with a patient that there's trauma or that there is depression that is holding them back, I acknowledge it and say, I'm going to work on you with the obvious physical things, but I'm getting a sense that this might be at play. What do you think? And some patients will say, absolutely, like, my other doctor just wanted to put me on an SSRI and I didn't feel better, and we can talk about other options. And some patients aren't ready, and I say, no problem. I always tell them, I reserve the right to bother you about this later. And so
yes, I like
if in 3-4 months, when I'm working on the lifestyles, I'm working on the gut, I'm working on whatever the problems I find, and you're not making progress, we've got to go back to the drawing board.
Yeah.
And I write, childhood trauma
right.
on their chart. And at that point, I might readdress it and say, have you thought about doing somatic experiencing? Have you thought about doing counseling with Lauren, who's right down the hall, who's phenomenal.
Yes,
right.
Lauren Gaiman.
And Lauren is phenomenal. And so a lot of times patients need that supportive piece. I'm not a counselor, not a therapist. And so I love integrating with other practitioners who can pick up the pieces that I'm not trained to do as well.
Absolutely. I think that we both like to have open mindset when it comes to those specialized providers like Lauren, like we have Aline Salou in our community.
Yep, who treats me. She's phenomenal.
Love her work of somatic experience too. And what other types of providers do you like to call upon, refer to, pick their brain with cases?
Well, one is you. So physical therapy. So I'm a male. I'm a solo practitioner. I'm the only one in my office. So although I was trained in GYN and OB, I don't do pelvic exams anymore.
Right.
And there are patients who have constipative syndromes, for example, and it turns out they have pelvic floor dysfunction.
Yep.
Right? They've got scarring from C-sections. They have trauma. And some of these patients, if I'm doing the treatments for the gut that should fix their constipation, but they're not getting better, it tells me something was missed. And so having you available to help with pelvic floor is wonderful.
Yeah.
Another is just general musculoskeletal health.
Yes.
So Amelia is also right next door to us.
Our orthopedic guru
Oh
of
my
physical
God, yeah.
therapy.
She's got all the experience. She's worked in so many different places. It's not just here, let's strengthen your quads for your knee. It's thinking about what are the biomechanics, and here's 6 different things we can try for it.
Yes.
Right. So,
Yeah. How all things move together.
yep. So I have patients who, man, I had a patient with shoulder pain. Amelia knocked it out in 2 visits.
I know.
That's great.
She is so fast
You're like,
in
yeah,
her
oh,
execution.
okay.
Yeah,
Yeah.
totally.
Cool.
And the movement piece, I do, well, of course, because I love the movement part.
Mm-hmm.
When, the case that you're presenting, the picture that's unfolding of this type of patient who's been around the medical community and is still sick. I think it's worth mentioning here. The movement piece is such a big piece,
Yes.
such a big correlate with
Yes.
if they're going to get better or not.
We think of functional medicine being looking for the root cause, and one of the main root causes of illness is simply how we live. We live in a very sedentary world.
Yes.
I stand and sit in front of my computer all day, and so many professionals now are just glued in front of their computer.
Yeah,
and this
in
causes...
one static posture, y'all.
So you could explain better than I, but I'm seeing cervical disc herniations at an early age. I'm seeing all sorts of neck and shoulder and back problems, and
Text neck.
yeah, yep. I'm seeing metabolic derangements. I'm seeing more insulin resistance. I'm seeing higher incidences of body fat, lower skeletal muscle, which changes.
Younger. This is all younger.
Yep, which changes the metabolic health of someone, and that changes their cardiovascular disease health over time. And so, this is a really deep problem. But if we're right, then simply moving the body would help. And there are a ton of patients who, when I get them walking every day, and I've had several patients literally go from bedbound to regaining all of their energy by starting at 1 minute of walking a day.
Yes.
And then every few days adding another minute. And there's something magical that happens somewhere around the 35-minute mark where I tell them I have no idea what's happening, but I tell them your ATP, your mitochondria just turned on. And I let them know that I made that up. But there's something very distinct that happens with the nervous system health. I think with there's a trauma piece that can be released as the body slowly convinces itself it's safe and healthy enough to do this work.
The rhythmic.
That allows some healing. And so, yep.
Oh, I love that. Hitting on those...
And it's not just a hippie thing. This is in the conventional medical literature, progressive exercise therapy.
Oh, yeah. So, and that, are you referring to specifically gradual dosing?
Yep. It's
and
particularly
adding
studied
on...
in chronic fatigue, fibromyalgia, myalgic encephalopathy. These are pretty well-known, well-studied treatments.
Yes, and
they work. And they work because they're treating the reason why we're sick, right?
Totally.
No one's moving.
Right.
You got to be outside for your circadian rhythm.
Get outside, get out of bed, get those legs moving. And I would say this is that progression. The piece of it is so important that you begin at a low dose.
That the level that you're comfortable with.
Yeah.
So maybe it's a minute. Maybe it's 5. Maybe it's 10. But here's a pearl. So I see a lot of patients who have variants of chronic fatigue. Many of them have been exposed to toxins, mold, heavy metals, plastics, and they become really profoundly, devastatingly ill. And one of the reasons why they haven't healed is all of the doctors and well-meaning doctors, functional and conventional, push them too hard too quick.
Right.
They say, my treatment to detox is this. They give them way too much, and these patients fall back maybe 2 months, right? So they've been told that if they just get through a healing crisis or a detox or a herx that they'll get better. But the honest truth is that those things very rarely work. The body's trying to say, you're giving me too much, please stop.
Sure.
So the right move isn't to do more of it, it's to back off and build up a way to make them more resilient.
That is wonderful visual of how we would treat any type of fatigue issue, right? Because we need to work on conserving energy. And we need to work on, it even makes me think of one of the other pieces of your podcast recently that I listened to about just resting the gut, how healing that is.
Fasting. Yeah, this is the reason why fasting works so wonderfully. Yeah.
Not overdoing it.
Yeah.
Just in general, right?
It's hard for our society to take a break, but
Yeah.
it really needs to.
Yeah,
It's
totally.
okay not to work all the time.
Yeah.
Yeah, it's all right.
It's okay not to eat all the time. It's okay not to drink all the time. Like, we are in New Orleans here, so we do have
Yep.
many
Yep.
many playgrounds of eating and drinking and all the things, and then sit at your desk all day and sit at a computer. So, okay, so counteracting some of those modern society lifestyle things that can really get at us,
Yes.
our work lifestyle, being dehydrated, eating convenience foods that are processed.
And then the next stage is going to the gut. So
Yes.
there are absolute patients who come in and they're sick and they have a freaking perfect lifestyle, right? They are eating healthier than I, right?
Getting
And
8 hours of sleep.
8 hours of sleep. And, and when that happens, you don't just double down on the lifestyle. You don't tell them to eat healthier,
Right.
You give them an eating disorder, right? And
Right.
they should walk out. If they're already eating healthier and you tell them to do a diet, it's just crazy. But
Which that happens so often.
if a practitioner's only tool is a diet,
Yep.
and then they'll just keep doing the diet. But when the lifestyle pieces have been satisfied, when you don't have any basic low-hanging fruits like iron deficiency, sleep deprivation, OSA, sleep apnea, and they're still sick, you look to the gut because so much of chronic disease is in the gut. We have IBS is an epidemic in this
Yep.
country.
I've heard you say
Millions
everyone
and
has
millions.
IBS.
I'm biased because I treat a lot of patients with gut issues. So some days I feel like everybody has IBS.
But I mean, I feel like in integrative circles, we could all kind of nod our heads yes to that too.
Yeah. The gut, I focus a lot on the gut because fixing the gut so often fixes other systems. You clean up SIBO, brain fog goes away. You treat candida, the skin gets better, right? You soak up the bile acids, right? People all of a sudden have energy and their stomach starts hurting. And on and on and on. There's just so many places where treating the gut shows effect in other systems. And so that's kind of my next level, my next go-to, because you're more likely you're likely to help the GI symptoms, but also the rest of the body.
Right. And when you look at helping the gut heal, is that where you bring in supplementation when needed? That becomes more specific then to the gut.
Yeah. So then you need tools, right?
Yeah.
So you need to put things in the gut to heal the gut. So
Right.
so you're doing diet, you're doing sleep, you're doing fasting, right? Those are big three. But I am a huge proponent of probiotics. So I use a
Yes.
lot of probiotics, and it's important not to use one type. I use 3 in my patients, 3 classes of probiotics. And so my patients get a lot of probiotics because they work, right?
Yeah, right.
They not only reduce symptoms, but again, I'm looking for treatments that fix 2 birds with 1 stone, right? And so we know probiotics lower blood sugar. We know
Yes.
they help with brain fog. We know they lower the LDL, right? They are doing a lot of work in the body. They help with brain fog, depression, quality of life, constipation, stool regularity, abdominal pain. Just the list goes on. So if you're going to pick a first-line treatment, in my book, it's almost always probiotics.
Yeah, it sounds pretty powerful to rely on that.
They bind toxins,
Yes.
right? So it's a really helpful piece to start off with. And then it's per the patient. Some people will need herbal treatments for their gut. Some people will need antibiotics. Some people may need secondary tools like elemental diet or immunoglobulins in the gut. There's just a lot of tools that are available. And the gut is so much fun to treat because, like the kidney's hidden. Like it's hard to get at the kidney, but if you swallow a pill, it goes right where
Yes.
you want it to be,
Right.
right? And so
Right.
the gut is a pretty easy system to fix.
Yeah. I love that. And the adaptability in it.
Yep. And so in the general model of how I think about helping these patients, it's lifestyle fundamentals, number 2, gut, And then if you've done decent work on the gut, or if the patient really doesn't have gut symptoms, then you move to the third step. And that would be to look for biotoxins. Are they living in mold, right? Are they have elevated levels of lead in their blood, right? Have they been drinking from plastic water bottles their whole life and have female hormone problems, right? It's just a chemical burden.
Right.
And so here in New Orleans, most of my work is on mold because we live in a very humid city that is occasionally underwater, as you and I know from our street.
From our street, yes. And from our history of living here, I tell patients you just have to grow gills in the summer here to be able to breathe the air.
Yeah. I tell people that they should be getting in a sauna or walking outside.
Or just walk outside your door and breathe. Yes.
Yeah, exactly. And so as I journeyed and tried to get more and more patients better, at some point I hit a ceiling where all the lifestyle work, all the dietary, all the gut only got me so far. And there was a group of patients who were just still so sick no matter what I did. Those are the patients who usually are living in a moldy environment, or maybe their environment is clean now, but the last 3 places they lived was packed full of mold, and they're just full of mold toxins themselves. And so this is where the detoxification work begins.
And so when you have kind of narrowed it down and they're in that mold population, I'm curious about how prevalent that is in the cases that you see. Like, what can you give me a percentage?
It's so hard, Kelly, now because people seek me out.
Yeah.
Because they know I treat mold.
Yeah, because Dr. Joe's the mold guy.
And so I don't know that my estimate is worth anything.
Okay.
Because I'm biased, right? Because people are seeking me out for this.
Yeah.
I'll give you this. So this is my opinion. This is not anything I found in a research study, but I think most patients who've been diagnosed with chronic Lyme don't have chronic Lyme, but are instead sick with mold.
Yeah.
I think they were misdiagnosed.
That is not a far reach.
And so that's a lot of patients out there.
Right.
And I've treated now many patients who came in and they wanted me to treat them for Lyme, and I treated their mold and they got better, and maybe they still had a lab marker showing positive for Lyme, but they were 90% better.
Right.
You didn't need to treat the Lyme.
Right.
It wasn't the cause. It wasn't the problem.
Yeah, that's really fascinating.
Mold is so devastating to the immune system that it causes a lot of secondary problems. And so treating mold is just as much about rebuilding all the broken systems as it is fixing the mold and removing the patient from a moldy environment.
Totally. So this would be mold remediation in their home or moving out of that home. Right?
This gets really hard, and it took me a while. I had to be utterly convinced that patients were sick with mold and that their environments were making them sick before I started telling them to move, because, God, what a big thing for your doctor to ask you. So
psychologically,
I really have to feel very confident before I would say that. But there are a couple ways that we can help figure out, is this the problem? The single best way, there are mold inspectors who can come to your home and do various tests. I find that those tests are a little outdated, and in my patients at least, almost all of them have had at least one negative test in their home, and then later we'll find out to have mold later.
Gotcha.
So I really worry about some of the air trap tests.
They might not be reliable.
They may not be reliable. The mold is under the floor and in the wall, but they're testing for mold in the middle of the room, in the air. So this to say, there are other tests to do other than air, but my favorite way to see if a patient is being exposed to mold and might need to move or remediate is to simply have them go on a vacation for 10 days.
Yes.
So this can be, I call it a mold move, right? It's a trial, right? It's not selling your house. It's not spending $3,000 on testing. It's go stay in an Airbnb for 10 days.
Wait, I would love to be able to get that prescription from.
I have written a prescription for that before.
10 days vacation. Thank you.
Well, so it doesn't have to be you're not sipping cocktails on the beach. It can be you go stay with your mom.
Right.
Just you go stay with your friend. Get out of that environment. And if you are being made sick by your environment, patients generally feel across the board multiple symptoms get better. And it's not like a little bit. It's not like, maybe my skin's a little clearer. It's like, oh my God, my brain fog is gone and my digestion is better and I'm not crying every day.
Wow.
Right? I'm 40% better across the board. It's not that that cures you in a week because these
Right.
patients are usually pretty devastatingly sick. The patients who've been sicker for mold, sometimes it takes longer. That's why I say 10 days, because sometimes it takes about 7 days
Right.
for their really vulnerable patients to turn it around.
Right.
But the key here is you should feel better in a different environment. And it doesn't have to be a zero mold environment. It just to have less mold in your house.
Yes.
Okay? Right? And the key then is they feel better in the other environment. And then when they return to the home, all the symptoms come back, usually in 24 hours.
Wow. It's
And
like
so
falling
if
off a
that
cliff.
pattern happens, then maybe it's not mold. Maybe it's asbestos. Maybe there's carbon monoxide. Maybe there's radon. Whatever the problem is, it's very clearly environmental.
Right.
And if you're being made sick from an environmental source, the treatment for poisoning is to stop drinking poison. You
Right.
have to not be in that environment. And
Remove
so
the source.
maybe it means then that they're convinced there's a problem and they may spend $1,000 or $2,000 in the bathroom now, and then in 6 months they might work on the kitchen.
Right.
Or it might be that they're in a place where they just go stay somewhere else until
Right.
they're better.
And so okay, thank you for explaining that so well. And in this particular case, I'm assuming that you can't do anything medically for them if they're going to continue in the mold or toxic environment, right?
Nope, that's
Like, you
that's
could
not true. There are some doctors who
Okay.
say that, but I think that that's really unfair to a patient who's
Okay.
really, really sick, because those patients inevitably they haven't been given the right treatment. They've been said, here is all the glutathione you can eat. We're just going to detox blast you.
It just hasn't been
here's
treating
all the
the issue.
antibiotics. Right. So there are fundamental treatments that can help build their resiliency. So maybe, and here's the thing. So if they're in a moldy environment and I give them everything I know to do, and mold is their cause, they only get about 20% better
Okay.
with all the treatments. So there comes a point in some cases
Yeah.
where we're 6 or 8 months in and I'm like, geez, Nick, like I don't know what to tell you, man. Like I've given you everything and you're 20% better. That's not good enough for me. I know you feel like hell. Like I think you got to try staying somewhere else. And sometimes that gets
Yeah.
them through.
It's something to get over the hump.
Yeah, exactly. So being dogmatic about move now, that doesn't help
Right.
anybody. And I won't treat you until you move.
Right.
They can take probiotics. They can do limbic retraining. They can do therapy. They can do walking. They can get off the thyroid medicine that they're taking too much of, or whatever it is. Right?
To help their nervous system become more resilient even when they're in that environment.
Yes, yes. And that's where the limbic retraining really, really helps calm the nervous system. And that can make the difference between someone healing or not.
Yes. So that entire category of the autonomic nervous system, I would love to spend another whole hour on that topic with you. I'd love to spend another hour even on the mold, right? I'd love to spend another hour on SIBO,
Sure.
your SIBO brain I want to pick. So why don't we do a part 2?
I would love to.
And that would be really fun because I learned a lot from you tonight. I loved how you were able to walk us through, some of this problems within the functional medicine system and how your work is disrupting that in a way that helps the individual patient to find healing and to actually feel better at the end of the day.
I think disruption is the right word. And it's so hard because I'm really not a bomb thrower. I'm not a very confrontational person.
You're just going to
as
write
you
a
know
book
me.
full of confrontation.
I know, but why the field needs to be disrupted is it's hurting too many people. So
Yeah.
if it was just a doctor making a lot of money on the side, who the hell cares? But
Yeah.
when it comes to the point where the patients are being hurt by these practices, that's when I think we need a line in the sand. And that's
Yeah.
when some of this stuff needs to be called out.
Absolutely.
Lovingly, because, if I didn't learn functional medicine, I wouldn't have been able to help so many patients. But also the field needs to grow up.
Yeah, grow up and just grow, right?
Yeah.
Evolve. Okay, so let's wrap it up with this question. What is one of your favorite wellness practices to keep your mind, body, and spirit feeling good?
So I'm Buddhist, and meditation is the answer. So, in particular, this past year, because I've been dealing with, as you know, a herniated disc in my back, and so you haven't
Not
heard me
fun.
playing drums in the neighborhood. I haven't been able to run, and even at a point, walking was just really, really flaring my back, just making it hard to get through my day. I've been meditating a lot, and I feel like this is the answer to a lot of the societal problems with our attention spans, and we are asked to have our attention in so many different places, and that causes suffering and anxiety and depression. And I think the American society at large could use a dose of 20 minutes of meditating on the breath every day.
Yes.
Or whatever practice works for you. I mean, this works for me, but that's the first answer that comes to my mind is very clearly learning to meditate and giving it time, because it's hard. It's really hard if you've never meditated before. But it's one of those things that it's like any skill. The more you put into it, the more you get out of it.
Yes.
Right? And it's almost like you have to get up the hill, push that boulder up the hill far enough to where then it starts rolling on its own. And then you see the benefits carry into your life.
That's beautiful.
But it's hard pushing it. It's hard pushing it up. You're like, the first time you meditate, your mind just goes away and away. And even today, I went on a walking meditation, and
nice.
and almost every 2 breaths, I've been meditating for 4 years, my mind was wandering.
Yeah.
And so it happens, and it's okay.
Yeah. Right. And to accept that, and to have the like you said, skill to come back.
That's it.
And come back and come back. Yeah, that's really beautiful. I love that. Well, thank you so much, Dr. Joe Mather. I really love talking to you, and we will come back again and dive into some other categories together. Thank you.
Thank you.